Please go ahead.
Good morning, ladies and gentlemen. I bring greetings from the holy city of Varanasi, India, to all of you, the city of Lord Shiva. And I'm going to present my paper on deworming the patient reduces surgical site infections in a developing country. I work in Banaras Hindu University. When solving problems, we should dig at the roots instead of just hacking at the leaves. That's a great saying by Anthony. I'll just give an example that Ignic Semmelweis, he was an Austrian obstetrician. He demonstrated that just by washing hands between two deliveries, it reduces the maternal mortality by 10%. His colleagues did not believe him. Today, even WHO is emphasizing on significance of washing hands. When we are examining many patients, in between we should wash our hands to prevent transmission of infection. When I was a student, I used to read Valley and Love Short Practice of Surgery. Nowhere the name of Ignace Semmelweis was mentioned, but today when I was reading the latest edition of Valley and Love, his name is mentioned there with respect. So that is one example how simple things can reduce infection. What I want to emphasize is the role of parasitic infestations in producing infection, and if we deworm the patient, we can reduce infections. According to a World Health Organization report, about 25% of the world's population is suffering from worm infestations, not only in developing countries, but also in developed countries. So 25% is a huge amount of people. Now, these are the various kinds of parasites which are present, and we see in our Indian patients, especially roundworms, hookworms, threadworms, and especially the amoebiasis. And if we search carefully, each and every individual is having some or other infection in his body. And this is Entamoeba histolytica. We can see a lot of ulcerations. Filariasis is very common. You know, we have got huge number of patients suffering from filariasis. Whenever a patient comes to me with fractured neck femur, elderly male, he is invariably having filarial hydrocele, large hydrocele associated with filariasis. So this is a very common infestation in our country, and almost all elderly patients who come to me in Banaras Hindu University are having filarial hydrocele. Whenever they come for trochanteric fracture or neck femur fracture, that is invariably associated. And the overall prevalence of intestinal parasitic infestation in India is about 50% in urban population and 68% in rural population. That is the report in the Indian Journal of Medical Research published. A study was done by us to determine the prevalence of intestinal protozoal and helminthic infestations in rural population of India, and the overall prevalence of various parasitic infestation was found to be 97.4%. The parasites, they not only steal our nutrition from the host, but they cause immunosuppression for their own survival and predispose the host for bacterial, fungal and viral infections because they cause immunosuppression. It is written in the textbook of Cecil Loeb that filarial worms, they suppress our T lymphocytes. T lymphocytes count goes down, and this will lead to more infections by bacteria and viruses. So we divided our, we made some observations. Two groups of 2,000 patients each who were undergoing elective orthopedic operations were studied for the incidence of surgical site infections. Cases getting infected within a month of surgery only were included in this series. In group 1, the patients were only given analgesic and prophylactic antibiotics as it is written in the textbook. No textbook writes that we should deworm the patient. No textbook of orthopedics writes that we should deworm our patient, and most of the surgeons, they do not practice deworming. No attention was paid to parasite in this group by not doing deworming. and doing what is written in the book. In group 2 patients, they were thoroughly investigated for parasitic infestations. Stool for ova and cyst was done for 3 consecutive days. Their blood was examined for microfilariae and other parasites. Patients were dewormed before surgery, and their nutrition was also improved by giving them calcium, vitamin, iron, protein, and blood transfusions when necessary, if they were anemic because of worms. In group 2, we use this albendazole 400 milligram or levamisole 150 milligram was given. The albendazole was given for 3 consecutive days. Ofloxacin and onadazole tablets were used for 5 to 10 days for amoebiasis. And we used diethyl carbamazine citrate for 21 days. And the course was repeated every yearly interval in these patients if they came to follow up. Niclosamide was used to treat the tapeworm infestations. Now, deworming of all the family members was also encouraged, because if one person is suffering in the family, we know that others are likely to suffer. So, we dewormed the whole family members, and the patients were educated also regarding hygiene and washing hands and so on. Reinfestation of filarial infestation was prevented by encouraging the patient to use mosquito nets, mosquito repellents. The 2 groups of patients which we observed were almost similar in other parameters like age, sex, type of operation done, and treated in the same operation theatre and ward under same situation. And they were treated in the routine operation theatre by senior consultants. Out of 2,000 patients, this is the statistics of infestations which we were able to detect in our patients. 460 had filariasis, 400 had amoebiasis, 220 had giardiasis, 230 had both amoebiasis and helminthic infestations, 110 had ascariasis, and 120 had hookworms. 330 had other infestations like H. nana, Taenia solium, ascaris, A. duodenale, threadworms, and 200 had tropical eosinophilia, probably due to occult filariasis. The incidence of surgical site infestation, this surgical site infection was 13% in the undewormed patient. If we didn't deworm, no attention was paid to parasites, and it was only 0.2% in the dewormed patient, and there was, the difference was statistically significant. These were the various organisms which were detected in our infected patients. Staphylococcus aureus was the most common organism, followed by others. This is the type of surgery which we performed and observed the patient in both the groups. Both the groups were almost similar. These are some of the cases showing infection where we did not deworm the patient. You can see the discharging sinus there. These are the undewormed patient where attention is not paid to the parasite. Here the spinal surgery has been done. The patient has developed a lot of infection and bed sore. This nail is also infected. You can see the loose screw. This child, the cava is infected. Here infection developed which was treated by cement loaded with antibiotic weeds. The plating got infected, like this nail got infected. So these are the examples how these patients, they developed. This shows large hydrocele in patient. Again, infected patients with discharging sinus. This implant also got infected. You can see this wound along with infection. Infected dynamic hip screw. So infection is very common in our country. Incidence varies from hospital to hospital, from place to place, and so it is concluded that in developing countries, surgeons should see the patient as a whole and not through the hole. Deworming reduces the rate of surgical site infection in the developing countries, especially tropical countries where parasitic infestations are very high. So thank you for your kind attention.